The Electronic Preventive Services Selector. There's an enormous amount of resources available to inform the doctor and patient. Yet, where does one begin? And are there one-stop shopping sites that allow easy link-outs to relevant resources? A new resource, including a related app, has surfaced, which is one of the best portals to relevant resources for clinicians with a focus on preventive services. A group that is part of the U.S. Department of Health and Human Services, called the Agency for Healthcare Research and Quality, has assembled and designed a robust site and app that will assist the busy clinician in navigating through the overwhelming number of resources. Here we see one page under the Patient and Consumer tab, but note there are tabs for healthcare professionals and policymakers. Here is the one for providers. Note the link-outs to several important data resources: the National Guideline Clearinghouse, the U.S. Preventive Services Task Force, and the Guide to Clinical Preventive Services. The U.S. Preventive Task Force is, quote, an independent group of national experts in prevention and evidence-based medicine that works to improve the health of all Americans by making evidence-based recommendations about clinical preventive services such as screenings, counseling services, or preventive medications. They make recommendations, sometimes controversial ones, on topics such as screening for breast cancer, prostate cancer, and colorectal cancer. They also make recommendations based on risk related to age, gender, and other factors. Recommendations are broad in scope, including screenings for glaucoma, scoliosis, alcohol abuse, hypertension, and pretty much all common healthcare concerns. If only these were accessed, keeping current, certainly regarding recommendations for prevention and screening, would be achieved. Later, we'll see how the AHRQ app allows individualized searches of these recommendations. But let's focus on the new electronic tool developed by the AHRQ and take a quick tour of its breadth of resources. It's called the Electronic Preventive Services Selector. Here's the home page for this new resource. You can see that there are numerous formats to choose from, including Android, iPad, Windows, and a web-based launch. Simply choose the most convenient one for you. We'll select the web-based. Clicking on the web-based link takes you to this navigation page. We're going to start with the left-hand banner tabs, and then we'll swing back to the link-outs to valuable calculators. Let's start with Tools. By clicking on this link, a world of resources appears. These are tools that assist in implementing the recommendations of the task force. You can see here an alphabetical listing of resources, including websites, PDFs, and online calculators. The range is wide, including, among others, tobacco cessation resources, screening for alcohol, depression, a BMI calculator, a cardiovascular risk calculator, and a host of patient information resources across many major topic areas. Let's look at one of these to get a flavor of what is available. One of the major concerns for patients' time to recovery for most musculoskeletal conditions is depression. Here we have a link to the most recommended screening questionnaire, the 9-question Patient Health Questionnaire. Clicking on this link opens up a PDF version of this questionnaire. Use of this tool is sensitive for depression based on the DSM criteria for major depression. Basically, a score of 10 or greater is a strong indicator of depression. Now back to the Tools page and the link to the Framingham Coronary Heart Disease Risk Calculator. Here's the page that allows access to the evidence report upon which the calculator is based, and then a link to the Risk Calculator page. Here we see the rationale and background about the risk calculator, an algorithm of the recommendations, and several options including an app, a download option, and simply a launch. Let's choose that. Here we can see the fields that represent the factors upon which the risk score is calculated. This includes age, gender, race, systolic blood pressure, HDL and total cholesterol, and whether the patient is diabetic or taking blood pressure medication. Filling in the data for a 55-year-old white male who is not diabetic or taking blood pressure medication, but has an HDL of 20 and a total cholesterol of 200 and a systolic blood pressure of 140, we can see the risk estimate. Although the 10-year risk appears low, the lifetime risk is 46%, a valuable visual for this patient. Now let's move on to a unique feature of this site and app, the search for recommendations. Here we can see the option of entering in an individual's unique characteristics and based on these getting the task force recommendations for screenings and preventive services. Let's create a profile. This will be a 55-year-old male who does not smoke and is sexually active. Based on that profile, we see the unique recommendations for this individual based on the U.S. Preventive Services Task Force recommendations, ranked by grade of evidence. We can see the recommendations for conditions including colorectal cancer, high blood pressure, HIV, lipid disorders, and syphilis, based on specific qualifiers. Let's move back to the EPSS homepage and access the two calculators, starting with the BMI calculator. The link out is to the National Heart, Lung, and Blood Institute. Here's the calculator available in standard or metric weight and English or Spanish. Let's fill this out for a 5'2" individual weighing 170 pounds, and we see the BMI of 31.1. Referring to the BMI categories on the right, we see this qualifies for obesity. Now back to the EPSS homepage and the link to the scoring system for osteoporosis. Here we see the risk assessment instrument designed to determine the need for dual energy X-ray absorptiometry. There are drop-down menus for each of these three elements. We chose between 45 and 54 years of age, 60 to 69 kilograms, and taking estrogen therapy. The recommendation is that the patient should not undergo a screening DEXA scan. So let's switch the profile to the age category of 65 to 74, weight of less than 60 kilograms, and no estrogen therapy. Here we see the recommendation is that the patient should undergo a screening DEXA scan. Now back to the home page for the BMI calculator. Here we see an option for public access. Clicking on that, let's look at resources. Here it is with information related to the heart, vascular, lung, blood, and sleep, and PDF-related documents. More importantly, further down the public page are pamphlets that patients can download or print as PDFs, including lifestyle modifications, lowering high cholesterol, etc. Finally, returning to the home page for the National Heart, Lung, and Blood Institute, we see a link for health professionals. Let's click on Systematic Evidence Reviews and Clinical Practice Guidelines. This is an extremely valuable resource for the Joint National Commission recommendations related to hypertension, managing cholesterol and blood pressure, lifestyle interventions, and assessing of cardiovascular risk. Let's look at the Managing Blood Cholesterol for Adults. Here's the homepage with links to the published articles related to management of cholesterol. Exploring these resources will reveal some recent changes and their rationale. So hopefully this brief tour of this new resource has demonstrated its ease of use and breadth of coverage. For those interested in the most recent evidence-based recommendations on preventive services, this is a great place to bookmark or download as an app.